Hi everybody, and welcome to Introduction to Evidence-Based Practice, our first lecture. Our teaching assistant for today is Max. Max is very sleepy and angry that I've woken her up just to show her what evidence-based practice is, so she's going to leave us shortly. So basically what we're going to cover today is what is evidence-based practice, sometimes called evidence-informed practice or evidence-informed decision-making, what the components of it are, where it came from, how we use it, and why it's important. So evidence-based practice can sometimes called evidence-informed practice because we don't always have a large base of evidence on which to rely. For some things, such as animal-assisted therapy, for instance, there aren't a lot of research studies yet. It's only starting to be examined scientifically, and all we have for now is anecdotal data that it probably works in several cases, including with incarcerated individuals, youth, etc. So that's why sometimes our practice is informed by the evidence that is emerging. There's not yet an evidence base upon which to rely. However, it's not just the research evidence that's important for evidence-based practice. It's actually the equal consideration and integration of four key concepts. The first, as I mentioned, is research, but there's also the case context, the service user preferences and values, and lastly, the social worker and organizational biases. And we will go through each of these today. Basically, evidence-based practice occurs when we have the equal contribution of all four and are able to hit right here. Sometimes that's not possible. We can only get 3 or 2 out of 4, but we do our best. Evidence-based practice actually came out of the medical field back in the 1990s when it was called evidence-based medicine, and it was an attempt to make decision-making in medicine based on the evidence as opposed to based on doctors' experience, practice experience, to make it more aligned with all the newly emerging medical research that was coming out in the 80s and 90s. Currently, it's used not just in medicine and nursing, but also in education, mental health, social work, and safety assessments. With social work, it's important to consider how we're taught about evidence-based practice because it's only recently become part of social work curriculum. Therefore, it's still lacking in a lot of social work practice and social work policies within our social work organizations. And it's very based on geography. You're more likely to see evidence-based practice used in large urban centers where there's a lot of resources to allow for that translation of research into something that's usable in practice. There's also several organizational and individual characteristics that will determine whether evidence-based practice is going to be used in an organization or not. At the organizational level, you have to consider what the policies are in the strategic plan. So what is the organization attempting to do and how? Are the interventions based on evidence? Is the strategic plan itself based on the available evidence? And a lot of that will be based on the culture and the climate of the organization. So is the culture of the organization open to trying new things, or are they very much set in stone and of the opinion that this is how things have been, so this is how they're continued to be, which is quite a bit of a problem, especially when new and very promising interventions come out. Second, is the organization a learning organization? So is it open to learning about these new interventions and practices that are emerging? Is the leadership open to change or not, or is it very much set on keeping things as they are? And lastly, is the organization as a whole motivated to change and assess its practice or not? And this is mirrored at the individual level. So workers have to develop case plans and referrals and provide interventions. But are these interventions actually based on evidence, or again, are they just how we've always done things and nobody's died yet, so we're going to assume it's working? Just because something is working doesn't mean that it's the best strategy for what's going on, and there could be better things that we could be doing. A great example is the Scared Straight program. Some of you might have heard of this. It was very popular in the 70s and 80s and 90s, and there's still a TV show out there today. But basically, they took at-risk youth and tried to scare them straight by giving them tours of prisons and having incarcerated individuals share their life stories, but not in a helpful way. It involved a lot of yelling at the youth and kind of trying to scare them, under the assumption that the reason these youth were at risk of criminal offenses was because they didn't realize how serious prison was. Of course, when you actually looked at the numbers, they found that there was absolutely no effect of the Scared Straight program. In fact, youth who went through the Scared Straight program were more likely to be incarcerated than youth who did not go through that program. And of course, when we think about it critically, we realize that it's not just, fear of prison that is playing a factor there for youth. There's lack of resources, educational difficulties, mental health issues, substance abuse issues, lack of mental health and substance abuse treatment for youth, especially those who are right at 18. And they get cut off from any adult programming that is available. So all of these other factors are playing a role, but the program that received the most funding and that carried on the longest was the one that did not work, unfortunately. Other areas of individual level practice that can incorporate evidence-based practice are how we discuss their options with families, how we engage in our supervision with our supervisors, and also what our self-efficacy is. So self-efficacy refers to your belief in the ability to do your job. So having the confidence that you are capable of doing your job, that you have the skills needed to do your job. A lot of social workers are hesitant to use evidence-based practice because they don't believe they have the necessary skills to engage in EBP. So what this class is going to do is give you those skills. And then, as at the organizational level, do you have leadership that supports the use of EBP, and do you personally have the motivation to engage in evidence-based practice? So why do we want to be evidence-informed? Because we are continuously making decisions that impact the lives of others. And those decisions and the services that we provide need to be guided by multiple sources of evidence. Not just this is how we've always done things, but is there actually proof that what we're doing works and isn't harming people? There's also the complexity of issues and the fact that multiple concerns need to be addressed. This, again, is in line with the EBP thinking, which supports critical thinking to ensure that you're always doing the best given the client context. And it's also ethical, according to our social work code of ethics, to ensure that the services we are providing are in line with the latest research, because if they're not, social workers can cause harm, as we saw with the Scared Straight program, but in many other scenarios as well. We're going to continue and look at each one of these four in a little bit more detail. So first is the case context, and this is always based on the assessment that you provide. The assessment itself can also be based on evidence, because we need to know what to look for in any given situation, and We know what to look for based on, for instance, risk assessments that are developed by analyzing many cases over the years to see what are the most important factors that somebody who is doing the assessment needs to watch out for. And what information they need to gather. So a lot of that gathering information and asking the questions, it relates to making sure that you're asking the right questions in the right way in order to gather the important history of the child or family and get an idea of what the strengths and needs of that family are. So focus not just on the strengths, but also some of those risks that might be there. Second is their service user preferences. So for your client, what do they actually want to do? What do they view as their strengths and needs? That's important because it will impact what interventions that they're going to be open to or not. You also have to consider that it's impossible to be culturally informed about all different cultures. Canada is a very multicultural country, and not everyone practices every culture in the same way. Therefore, we should engage in cultural humility and really depend on the client and ask the client about what their preferences are and how we can best ensure that the interventions meet their cultural needs. And as well, we have to engage in anti-oppressive practice with the service user to ensure that the way the interventions and these assessments are conducted are not perpetuating ongoing discriminations. Next is the worker and organizational experiences. So we practice in an environment that has a lot of noise in it, and I will show you some examples of that in a second. But basically, there's a lot of information coming at us that might cause us to lose focus from the client. For instance, we've got resource limitations we have to attend to. There's always things in the media that might impact how we practice, such as a critical incident. For instance, if a client in the agency has died, or if you're in child protection and there's a child death, that will change the organizational culture in how people practice. And at the same time, we've all got our individual biases and heuristics. So heuristics are these sort of shortcuts that our brains create in order to process information more quickly. For instance, when you walk into a Tim Hortons, you might immediately order a double-double. You're not going to read the entire menu each time. You're going to have your preferences set and your order ready as you approach the counter. But suppose you walk into a coffee shop that's not a Tim Hortons, a Starbucks, for instance, and you try to order a double-double as habit. That's not going to work there. You have to, know their size for their cups and how they speak their language, basically. It's the same with practice. What you might be used to doing for a certain client group might not work for a new client. Unless you're attending to these differences, you'll miss it and you'll provide an ineffective intervention to a client. And lastly, we've got the research evidence. The research evidence itself is based on several things. First, what was the research question asked? Is it the same as the question that you have about the intervention or assessment that you're doing? Maybe it's looking at things slightly differently from what you actually need. And you also have to consider the methodology. Just because something has been published doesn't mean the research methods were the best possible. So you always have to be critically assessing the research that you come across. And some of that practice, noise, and social work I mentioned, apart from say, resources is the fact that you as a social worker will be exposed to vicarious trauma and organizational trauma as well. The organizational culture is going to influence how you're able to do your practice. Same with your caseload. If you have a very high caseload, you can have a lot less time to rely on the evidence. So we have to work to reduce some of this noise at the organizational level in order to ensure that we have the time and the resources needed to engage in evidence-based practice and to provide our clients, the families and children that we work with the best possible services. So there are some myths about evidence-based practice that you might have heard of. For one thing, you might have heard that it's all about the research, but as we just saw, there's 3 other components to it, including the worker, i.e. you, the client's preferences, and the case characteristics. And it's also not all about the quantitative research. There's a lot of qualitative research that's been very helpful for determining the fact that things like animal-assisted therapy are very useful for decreasing the social isolation of people in nursing homes. Third, the myth is that randomized controlled trials are the best type of research. This is incorrect. The best type of research is actually what's known as a meta-analysis, which takes the findings of all of the available studies on the given topic, looks at their quality, and then synthesizes them together to come to one conclusion. So across all the knowledge that we have, what is the best intervention in any particular case? And the last myth is that evidence-based practice is unethical. However, when you look at the Social Work Code of Ethics, you see the exact opposite, that the need to ensure that our interventions are based on the evidence-based practice is enshrined in our Code of Ethics. And the continuum of evidence use is actually, first, you have to be aware of the fact that there is such a thing as evidence-based practice. You need to understand what it is and then read up on what the best evidence is for a given topic or intervention, and then be willing to actually use it and ensure that your organization is also willing to change and to actually use these preferred interventions. So you basically go from conceptually getting your mind on the same side, and then later instrumental use, making sure that the organization and the practices are in place for you to actually engage in evidence-based practice. One of the important components of evidence-based practice is critical thinking. So you always have to be open to and seeking new information and alternative hypotheses for how things are done. Don't just accept the status quo. Be aware that individuals, i.e. you, as well as your clients, you have biases that distort the way that you think. So you always have to self-reflect and engage in active listening to ensure that your biases aren't clouding your judgment and creating faulty thinking or a false reality. Always consider information from multiple sources. So one research study is not enough to justify changing how work within your practice organization takes place. You need multiple research studies, such as a meta-analysis, to show that this is the best possible intervention. And always analyze, form conclusions, and articulate your thoughts with others. Evidence-based practice should not be something that you do in a silo by yourself. Should be in conversation with your colleagues and your supervisors, something that you all use together within the organization. I strongly encourage you to watch this video on how to encourage critical thinking with 3 questions by Brian Hashiro. It is available on YouTube. It's too long for me to include in this video though. It is about 17 minutes. So today we covered the 4 components of evidence-based practice. In the future weeks, we're going to look at each one of these in more detail so that you can actually apply them to your internship practice.